And now I want to start talking about some things that are coming not quite as soon. Refugees, people who've gotten asylum, trafficking victims will no longer be eligible for SNAP. And the next thing to look forward to is at the end of the year, if Congress cannot agree on extending those subsidies, enhanced subsidies for the Affordable Care Act. A lot of people, so that's for people where you don't get insurance on your job, through your job, so you might go buy insurance, private insurance directly from an insurance company. About 120,000 Iowans are in a position where they could lose those enhanced subsidies. And sometimes the subsidies they'll lose will be modest. Sometimes they will be really painful. So a 45-year-old making $32,000 a year, their premium will go up by almost $1,200 a year. But if you've got a 60-year-old couple, right, they're not eligible for Medicare yet, right? And let's say they're making $82,000 a year, which is solid money, but suddenly their premium is going to go up by over $18,000 a year. So what happens is the people who are sick, people who know they have to have the coverage, they'll figure it out. Right? They'll take on a second job. They'll let other expenses go. But some people are going to be like, I'm going to roll the dice. This is too expensive, and they will go uninsured. So that's potentially end of the year unless Congress comes to an agreement. So Iowa was one of the majority of states that took an option under the Affordable Care Act to expand Medicaid to a group of people who previously had not been eligible. And that's low-wage workers who were not eligible for coverage because they had children. Okay, so although some of these people do have kids, but their eligibility is not tied to it. But anyway, it's about 180,000 people across the state, including about 15,000 people here in Lynn County, who get their Medicaid through what is often shorthanded as Medicaid expansion. Okay, so they're low-wage workers who don't have benefits through their jobs or their caregiving, or they have their own health issues. So just to be clear, if you've got kids or grandkids at the child care center, if you go to Hy-Vee to grocery shop, if you are going, you fill up your car at Casey's, a lot of the folks who are helping you in those situations are probably getting covered under the expansion of Medicaid. And so that is the population that now is going to have to meet these work reporting requirements, which sound to me they don't, but I know to a lot of people they sound kind of innocuous. Well, you should have to work. And I want to unpack that a little bit. So first, let's talk about what these requirements are going to look like for people. So in order to meet the work requirement, you will have to show that you have worked at least 80 hours a month, so essentially half time. Or you will have to prove that you're in school at least half time. Or you will have to show that you were engaged in some other community service or work study kind of thing, half time, 80 hours a week, or some combination of the above. Now there is a loophole that is actually income that's equal to 80 hours multiplied by the minimum wage. It's a formula that actually makes it slightly less harsh. But does this sound complicated? Okay, well, let's talk about the exemptions. You can be exempt from this work reporting requirement if you're a parent or a caregiver of children or someone under 14 or someone with a disability, if you're pregnant, if you're a foster youth or former foster youth under age 26. If you meet very technical definitions of medically frail, that's kind of a federal term of art, if you've been incarcerated or been released from incarceration within the last 90 days, or if you're a member of a tribe. All of this will have to be documented and reported to the state anywhere from potentially monthly to every 6 months. When it comes to SNAP and Medicaid enrollees, the first thing is do not panic yet. Most of these things, other than some of the SNAP cuts, don't go into effect right away. Do not panic. I think the lesson to anyone who is using Medicaid or SNAP is make sure Iowa HHS has your current contact information so that when these things start rolling down, they can tell you about them. So you don't just show up at the pharmacy and realize you don't have health insurance anymore. Think about exemptions you might qualify for and how you might document them. There will be more information coming from the state. If you think you might have a health exemption, it might be worth a conversation with your primary doctor about a diagnosis and making sure that you're going to have some documentation for that. And then if you have other friends and family who are using these programs, give them a heads up that they should be paying attention as well. And then in terms of like community organizations, community leaders, nonprofits, religious communities, I would say there's conversations to be had. People are going to need help proving work hours, proving exemptions. How can we help with paperwork? And then how do we fill the gaps for people who will lose food and health assistance? Because even with help, some people are going to fall through the cracks. And then I think something we can all do is really kind of warm up our advocacy skills. Or yeah, I think many of the decisions on these programs right now actually are going to rest in Des Moines. The federal government has made its choices. Now it's up to the state to implement them. Officials, including lawmakers, really need to hear information and persuasion. They need to hear why these programs are important in our communities. And then we're also probably going to need to protect other services. And I'm really thinking schools, because as the state is going to be forced to take on more of the costs of Medicaid and SNAP, it's going to squeeze other parts of our state budget, of which the largest part by far is our public schools. We do a regular newsletter where we talk about these things. If you actually are a little wonky yourself and would like to subscribe to our newsletter, there's a QR code here, or you can visit our website, which is commongoodiowa.org. And I look forward to talking more when we get into Q&A. I'll turn it over.